All right, welcome back to Health and Wellness right here on K24. My name is Shiko Kaitani. Thanks for sticking with us today. We are talking about COVID-19 and the high-risk groups that we definitely have to talk about. What really does put you at that position where you may be, in rather the position that you may find yourself in of getting severe COVID-19 due to your pre-existing conditions? Some very interesting data also we did come across, even from the CDC, who are the Centers for Disease Control and Prevention, and scientific evidence for conditions that increase risk for severe illness of COVID-19. The question is, where do you fall? There are quite a number, but we have chosen to highlight today cardiovascular disease, chronic kidney disease, and diabetes. But look at this, the level of evidence, strongest and most consistent evidence for conditions like cancer. That has been highlighted. Obesity, severe obesity. In fact, one of our experts on set has actually highlighted that. Sickle cell disease is one of them, as well as smoking and type 2 diabetes. But still, we want to know about what you think are some of the misconceptions that are out there. In fact, that's our question of the day to you. And so we ask you, what do you think that Kenyans still believe to be true about COVID-19? We know we are living in the era of misinformation. And so what would you actually think Kenyans are probably getting right or wrong? Talk to us. 24 TV, and of course our number is at the bottom of your screen should you want to call in. In fact, Kennedy from Muhoroni says, my question is, what is the link between COVID-19 and DM in terms of nutrition? Okay, we'll put a point on that or a pin on that and get back to you in just a moment, Kennedy. But I'd like to believe that you're talking about COVID-19 and your lifestyle, or at least lifestyle-related diseases. We'll let the experts talk to you in just a moment, but still with us is Dr. Saira Sokwala with us, as well as Dr. Hussein Baga, and as well as Dr. Monsen Gabala, who is joining us via Skype. And so getting back to even the question, Daktari, Kennedy is asking about COVID-19 and nutrition. Can you make sense of that question? What do you think he's trying to get at with that point?
Yeah, actually, I get his question. It's like, if especially you have diabetes, and if there's any specific nutrition that has been linked to getting more severe COVID-19, that's what I'm assuming it is, right? Yeah. So basically, actually, there are no large randomized trials to show that specific link between nutrition, diabetes and COVID-19, but there's one study that I did come across. It's not actually a study per se, it's just an observational article that I looked at. And what we know from that article is like a high carbohydrate diet, and they talked of more of a high carb diet being linked more to severe COVID, or when you get COVID, like poor healing in COVID. But that's not like a randomized, a trial is like you compare whether you have given a high carbohydrate versus a low carbohydrate, high fat diet, and then you say that for sure this is the link. But overall, in general, what we know that high carb diet overall with type 2 diabetes, now what we are looking, at some point we used to say that, okay, a low fat is what is more important to control your sugars and for weight management and for cholesterol control. So diabetes is also linked with cholesterol issues, okay, overall. So what we now know is that most of the studies that have been done currently are focusing more on a low carbohydrate diet to control sugars in diabetes, especially like when you are looking mainly at type 2 diabetes in this case, and improving your outcomes as far as weight is concerned, as far as glucose control is concerned, as far as the requirement for medication is concerned to help your insulin to work better. Right. So it's more of now moving towards a low carbohydrate, high fiber, high, plant-based protein and vegetable intake, and moderation of fat. And actually, even the fruit category, what we should understand is fruits still have quite a high amount of carbohydrate. Right. So we're looking at that too in moderation. We're not saying you stop eating fruits, but basically the quantity matters. What we have been seeing actually, and this is good you've brought it up, is a lot of our patients with diabetes over the last few months, they've been coming in very high sugars. So you wonder what's going on, and you realize everyone out there is recommending use of oranges, you know, for vitamin C.
Yeah.
So they've been eating like 3 oranges in a day, or with every meal they've been including at least 1 or 2 oranges.
Yeah.
And you see their sugars spiking up. So that also has to be taken in consideration, that it's not all fruits which are safe and in any quantity.
Right, right. Okay, Dr. Hussein, what is obviously the advice or precautionary steps for some of your patients now that people are pretty much restricted? You've just talked about they spend a number of hours per week at the hospital, but how can these vulnerable groups really keep themselves safe, you know, at this particular time?
Okay, so the universal measures that are normally, that have been put in place and are recommended for prevention of contracting this disease, like I would urge all the Kenyan public, just please make sure that you wear your masks at all times when you are out in public. I mean, even when you are in your car with your family, you don't know who has contracted the disease, because there was a recent article in the BBC, I don't know if people came across it. The top experts in England are actually calling it a hit-and-run virus.
Oh, okay.
Because of the fact that when you get the virus, you are asymptomatic for quite a number of days. And at that point in time, you are infectious. So you infect somebody else, and by the time you're getting the symptoms and isolating yourself, it's already too late. The virus has hit you and moved on, and this is why they're calling it the hit-and-run virus.
Right.
So please wear your masks. Social distancing is extremely important, okay? We know that at least 1.5 meters is what is recommended. Washing of hands, another very simple but very effective method of preventing the contraction of the disease.
Yeah.
And then I would just like to weigh in a bit on what Mr. Kennedy had asked. And when you have a very high carbohydrate diet in somebody who is diabetic, like what Dr. Sokwala has said, your sugars go haywire. When your sugars go haywire, your immunity tends to go down. Your chances of picking up any infection becomes very high, including COVID. So your sugars have to be very well controlled, especially in this era of COVID-19. So your diabetes has to be absolutely well controlled, and even your dialysis should be continuous, so that you don't tend to develop, accumulate these toxins which cause immunosuppression as well and predispose you to getting COVID, and a more severe form of COVID for that matter.
Yeah, okay. Dr. Sokwala, the thing is, a lot of people had this question even before we came on the show, is that, okay, fine, if I have this pre-existing condition, aren't there any special measures or precautionary steps that I must take? Because I'm the vulnerable one here. So is there a different set of recommendations for them, even besides of what Dr. Hussein has said? So is there a generic type of, type of advice that you would give people, or is it for those who have these kind of conditions must follow specific steps?
So if you look at, I really appreciate actually basically what Dr. Hussein Baga has said about the precautionary measures. That is universal.
Yeah.
Whether you have diabetes, whether you don't have diabetes, whether you have any other chronic conditions. Now, one thing that we need to understand is that this vulnerable group, the highest risk is those who are above the age of 60 years. It's like a direct linear relationship between increasing age and what we call as case fatality or increased risk of death. Yeah. So that is like a direct relationship, and you must have seen that most of the data that we have is showing that the older age people are at a higher risk.
Yeah.
I'm getting to what you have asked, but that's why I'm getting you to the risk factors specifically.
Yeah.
Then you are looking at patients with type 2 diabetes, who again tend to be older, as I mentioned earlier. Who have about almost 2 to 3-fold higher risk of severe disease. Hypertension, similarly, about 40% of patients in ICU units have been found out to have hypertension, according to another CDC study conducted in China, I think. So basically, when we look at all these risk factors, and you're looking at now specific precautionary measures, in addition to what Dr. Baga has said, one thing you have to know is there's no point of panicking. You know, we have created, like, these patients, when they come to us, they are in a serious panic situation.
Yeah.
So your risk of contracting the virus is still equal amongst all those high-risk groups.
Right.
The point is, these are people who are taking care of themselves, sitting at home, probably isolating themselves, working from home. Many of our patients, the good thing is many of the employers have actually allowed them to be working from home, considering they have these high-risk factors. But what you don't realize is the people in that household who are working out. And that precaution, you know, like you've got an elderly person at home, and then you've got people in the same household, the younger generation or the younger people who are actually going out, working, mixing, intermingling with other people. Those people have to really be cautious as well. And they have to maintain a distance. This aspect of contact, physical contact also, we need to be a bit more careful with this particular group of vulnerable individuals. So when you come, like when the younger people or when the other people who are working out come to the house, they need to be very cautious in interacting with these high-risk groups, whereby you don't want to have physical contact, preferably keep a distance and, you know, greet them just from far. Have your masks on at all times. If you have any of these vulnerable individuals within your vicinity. At the same time, visitations should be limited to these high-risk groups. I'm not saying you socially distance. What we are saying is physical distancing. What that means is you can still I mean, we are quite lucky. We are in a generation where we've got internet. You've got phones where you can easily communicate with your family, with your friends, keep touch, you know, do video calls, see each other. It's not like you are completely detaching them. They need that support, especially at this time when they are already scared that they are in the vulnerable category. Okay? The other things now, as far as their now access to healthcare is concerned. So, like Dr. Baga mentioned, like at the MP Shah Hospital, for example, other than keeping all those precautionary measures, which I think every hospital has done in the country, what we have organized also is for teleconsultations or online virtual consultations, where you cannot come to the facility. You need to be able to access your healthcare providers, and that's how you can access. The other thing is to take care that your medication stock is, you know, up to date, especially if you're living out of the city where your healthcare provider is, in case of, you know, a lockdown or something like that, you have a good enough stock of medication at least for 1 month.
Okay. All right. I understand Dr. Gabala is back, and let me just engage him a little bit so that we can even get back to talking more about this month and the focus that, you know, we are going to be having on diabetes at some point. But getting back to you, Dr. Gabala, let's try and understand what these risk factors for heart problems are, because it seems like everything we are talking about really also does stem quite a bit from our lifestyle decisions. Can you tell us a little bit more about that and why it's so important to be living a healthy lifestyle?
Well, the risk factors, actually, if we look at all the risk factors for coronary heart disease, they are risk factors of even contacting other infection and getting other disease. For example, advanced age, like people that Dr. Sukola mentioned above age of 60, they are at more risk of developing heart disease. Patients who are smoking, because smoking, it will destroy all the mucous membrane from the nose down to the lung. And if they destroy the mucous membrane, they will be susceptible for even getting COVID infection. But they are risk factors. Smoking is risk factor for heart disease and even for the COVID infection. The atherosclerosis or high cholesterol, when you have high cholesterol, it will go and affect all the blood vessels in the body. Among the blood vessels are the coronary arteries, which goes to the heart, and it can cause heart problem. Hypertension, diabetes are also very well-known risk factors for coronary heart disease. Unfortunately, all these risk factors, they make our patient or cardiac patient to be more susceptible to the COVID infection. We have to remember that the diabetes, if it's not well controlled, it will lead to high sugar level in the blood. And the sugar is the best metabolite that the virus and bacteria will use as a nutrient. So those make those diabetic patient a risk patient to contract any infection, bacterial or virus infection. So those are the risk factors. There was a lot of discussion about the medication for the blood pressure. That one of the medication, which is very famous and is called ACE inhibitor, might affect the metabolism of the COVID virus and making the virus more virulent to destroy the whole lung very quickly. And actually, all the studies that I have read, both done in the US and in Europe, they showed that this is okay in the lab on animals. but not in human beings. So if any one of my patients is getting those drugs that are very important, we don't stop them, we just continue.
Okay. All right, Dr. Gabala, if you can still hear me, I hope the sound is okay. Let me just engage you in terms of what other diseases or conditions could probably be mimicking heart problems. Because when someone simply complains about chest pain, shortness of breath, is it a sure indicator that I probably do have a problem with my heart?
Right. Well, that's the $1 million question, because we get maybe 50% of the people coming to casualty, they actually complaining of chest pain or upper abdominal pain. So chest pain, there's more than 100 different reasons for chest pain, but one of them is heart attack or myocardial infarction. Because of the risk of the myocardial infarction, so we have to do a lot of investigation on those patients to be able to know if this comes from the heart or not. And that's the only question that we answer. Sometimes we are not able to tell if the pain coming from somewhere else and what is the cause for the pain. The most important, or the doctors in casualty, they're working on that mechanism to know if it comes from the heart or not. Because if it comes from the heart, it could be deadly. So that's one of the reasons for chest pain. Like, it can come from the stomach, it can come from the liver, gallbladder, it can come from the muscle of the chest wall, it can come from the lung sac, or even the heart sac. And all of them, they will give the same picture of a heart attack, but it is not a heart attack. The same like COVID patient as well. They get chest pain, they get breathing problem, but they don't have a heart attack, but they have inflammation of the heart muscle, which mimic the heart attack.
Okay.
Breathing problem, there's a lot of reasons as well for that. Even patients with kidney problem, that they cannot get rid of the fluids, they have fluid retention, and they can mimic heart failure or cardiac disease. Patients with asthma, patients with even some anxiety, that they hyperventilate, they cannot breathe. All this will mimic the heart disease.
Okay.
But,
All right. Dr. Hussein, if you could just shed some light on the quality of life that patients with chronic kidney disease actually live. The fear is, will I be able to have a full, or at least lead a quality type of life, even with this particular disease, and me having to go through dialysis at this time?
So that's a very good question, and a lot of people actually, by the time they reach end-stage kidney disease, most of the time it's because they have presented to us quite late. They don't present with the classical symptoms very earlier on, like what Dr. Kabala mentioned. They come in with difficulty in breathing, fluid overload. They'll be, most of the time they just present with generalized tiredness, body malaise, and they'll be like, I've been overworking myself, I need to rest, They get a bit breathless walking, and they're like, I'm out of practice and I need to exercise. So those are the symptoms, and it's considered to be one of those silent killers as well, together with diabetes and high blood pressure. So unfortunately, we pick up these patients quite late because of the late presentation. And once when we mention dialysis, most of the patients think that this is a death sentence. And a lot of patients actually don't even want to hear the treatment of dialysis for them. So dialysis is supposed to be a stopgap measure. Now, what dialysis does is that it acts as a surrogate kidney. Remember that our kidney is functioning continuously. Even as we were speaking, it is continuously filtering water, it is continuously filtering out the toxins. Now, what we are doing is that we are trying to use the dialysis machine as a surrogate kidney, but we're only doing it twice a week minimum. So the remainder of the time, there's still the toxin accumulation and the fluid accumulation and the bad electrolytes like potassium that are accumulating. So these patients, yes, we are saving their lives. We are improving to a certain point the quality of life, but it is not optimum. And the most optimum treatment for patients with end-stage kidney disease is a renal transplant. I mean, it was brilliant by His Excellency President Uhuru Kenyatta to initiate the NHIF to pay for dialysis. Because before that, patients were not able to afford the dialysis.
And hence they would stay away.
They would stay away and they would die. And we have seen it happening. But now, thankfully, because of his initiative, we are able to, we have more than 4,000 patients currently on dialysis.
Okay.
And before that, it was only 400.
Wow, that's impressive.
Yes.
In fact, we've got a question for you, Daktari. I can see someone trying to engage you here on diet. Hi, Shiko. Please ask the nephrologist what appropriate diet is required for CKD patients, because we are so much restricted to eat certain foods and fruits despite our potassium levels being stable. That is within the required range.
Yes.
So here comes again quality of life. And even when it comes to what they're eating, if something as what you're eating is restricted, you know, it pretty much puts people off. We've got Daniel here as well from Thika, who says, kindly, Daktari, do medicine stop or clear the formation of plaque in the arteries when one has ischemic heart disease? I believe I pronounced that right.
Yes.
All right, we'll save that for Dr. Gabala in just a moment. But yes, you can answer that question.
Yeah, so that's a very, very important question, because a lot of times people feel that because the potassium levels are within the normal range, which is 3.5 to 5.5, they should be allowed to eat whatever they want to eat in terms of the fruits and in terms of the foods that are high potassium containing. Now, what people don't realize is that it is because of the restrictions that we have put for them in terms of the diet is what is helping to control the potassium.
Right.
So majority of the potassium basically comes from the diet externally. And when we, a lot of foods contain very high contents of potassium. So the potassium levels would go up immediately, but it's because of your kidneys functioning normally, is because your potassium levels are maintained.
Okay.
So if your kidneys are not functioning and if you take foods rich in potassium, your potassium levels would definitely go up. So if you take foods like bananas, which have a very high content of potassium, avocados, which also have a very high content of potassium as well, coconut water, because there's this misconception that if I have kidney disease, I need to drink lots of coconut water because it has a diuretic effect and you'll start passing urine.
Right.
So especially in certain areas like coast, and even here in Nairobi, I've seen a lot of people tell me that, yeah, I've been advised by the local people, they take a lot of madafu, this coconut water, and that has a very high content of potassium as well. So when you take it and your kidneys are not working, remember we're doing dialysis only twice a week.
Right.
So the other times the potassium is actually accumulating. Now when it hits more than 6, it's actually having detrimental effects on the heart.
Right.
I've seen patients whose potassium go up to 7, and that is detrimental because it can stop the heart.
Immediately. Wow. Wow.
Yeah, so it's very, very important to maintain your diet when you have chronic kidney disease. Please, that's my sincere request to the public.
Okay. So very quickly, Dr. Gabala, as we say goodbye, we did have a question, and I want to ask my director if we can actually have that text message, because people, or at least one viewer has requested for suggestions on a dietary plan for someone who has heart problems.
Right. Well, as was mentioned before, the what we call electrolyte, which is sodium and potassium, calcium, all these substances or minerals, they should be in the body in a certain level, and they shouldn't exceed that range. If they exceed, as Dr. Hussein Baga mentioned, that actually potassium is very important for the heart.
Okay.
A lack of potassium and magnesium will cause a problem of the heart, and too much potassium and magnesium will even cause more problem to the heart. So if the potassium on the low side, it will make the heart very irritable, and it can go into arrhythmia. And if the potassium is too high, it will make the heart to stop, becomes a very slow heart rate, and it will stop. So you have to have a balanced diet to contain all these minerals in a good amount. We give sometimes to our patient water tablet, which will take extra water from the body, and it always take some of the minerals outside as well. Like the sodium goes down and the potassium goes down, and then they will have a problem of that.
Okay.
So sometimes we have to replace those things, and we have to tell them to eat a balanced diet, not to change the diet so much.
Okay.
And so on,
All right, thank you. As we start to wind up, Dr. Sokwala, you know, November now is your month. You're quite busy around this time because the focus is on diabetes amongst many other conditions. But what is the emphasis this year on diabetes as we say goodbye?
So this year, you know, like every year or at least every 2 years, the International Diabetes Federation sets a theme for the World Diabetes Day. World Diabetes Day is going to be on the 14th of November, and there is a theme every year or every 2 years, like I said. So this year the theme is on nurses and diabetes. Wow. And to recognize the important role nurses play in the management of diabetes, and especially focusing on diabetes education.
Right.
Specifically, because any type of diabetes you have, you need to have education on that, and it's a lot about self-management. So that whole role this year is focusing on diabetes and nurses. Yeah. And as MP Shah, we are going to have quite a number of events lined up. Yeah. We are actually planning to have a virtual nurses kind of the nurse educators for diabetes education for all of the Kenyans out there. We'll be organizing a virtual education session and focusing more on the role of the nurse in diabetes care alongside careful screenings in our facilities. Okay.
Well, we want to wish you all the best with that. I'm sure we'll be seeing you very, very soon, even on our screens, as we, highlight World Diabetes Day. But we want to say thank you so much to all of you for making time to be with us this morning. Unfortunately, we have to stop that conversation right here. But remember, the clarion call is if you do have a pre-existing condition, you simply must see a physician to actually diagnose the situation and tell you what is wrong. We have seen, of course, quite a number of situations where people are shying away, the public shying away from health facilities because of the fear of contracting COVID-19. But remember, where do you fall on the scale? Are you part of the high-risk groups that we have highlighted today? Please be in touch with a physician. And so, yet again, thank you so much to Dr. Saira Sokwala, Dr. Hussein Bag, as well as Dr. Monsen Gabala, our family from MP Shah Hospital today, joining us to answer some of your questions and discussing, of course, our vulnerable groups. Thanks so much for being with us. We will put you in touch with our specialists should you require their contacts. For me, Shiko Kaitani, and on behalf of the Breakfast Crew, thanks a lot for sticking with us. Let's make way for the Daily Brief that's up next. Bye-bye.